Welcome to our COVID-19 special on DW. The coronavirus pandemic has had a big impact on the lives of children. In many countries, schools and daycare centers have been closed. But recent studies show daycare centers could stay open without problems. But what about schools? We'll also be visiting India and Indonesia, where the rollout of booster vaccines is underway. And we'll meet a scientist who's working to develop a new vaccine in Indonesia. Shutting down daycare centers leads to a host of problems. Young children soon get bored when they can't play with others. For parents, it means children need to be looked after at home. Germany has not yet approved a vaccine for children under the age of 5. But despite that, a new study suggests daycare centers still don't need to close, because young children are better protected than previously thought.
It's Wednesday morning and the El Kavesne family are getting tested. Twins Nisa and Taha are 4 years old. They go to daycare. That means they have to be tested for COVID-19 twice a week. The little ones do not enjoy the procedure. But testing helps ensure that daycare centres can remain open. That's the conclusion reached by scientists at the University of Würzburg. They conducted a study over a period of several months, using different methods to test over 600 children, as well as their parents and daycare staff, for COVID-19.
And what we found out that parents whose children were participating in regular testing, they felt better about the pandemic and about the consequences of the pandemic. They felt more secure, and their psychological well-being was higher compared to parents where the children did not regularly participate in regular testings.
The scientists reached another surprising conclusion.
We almost could not find coronavirus infection in children who were regularly visiting our kindergarten and daycare institutions. So surprisingly, the new coronavirus did not spread a lot among children at the toddler age. And we think today this is due to special conditions of the immune system of children who have a very good capacity of their innate immunity to defend the virus on the mucosal surfaces and the nasopharynx.
Unlike with adults, pattern recognition receptors on children's nasal mucosa are highly active. They can recognise viruses early and release messenger substances, activating a flurry of defence reactions. Moreover, healthy children have more immune cells in their noses than adults do. That allows them to take on viruses and neutralise them more effectively. At the start of the pandemic, daycare centres were seen as superspreader sites and had to shut. It was hard for many children to adjust to the new normal. They didn't understand why we couldn't go out and do all the things we used to do. It was bad. They slept really badly because they just weren't tired. Things are much better now. Today, Nisa and Taha have both tested negative, so it's off to daycare. Parents can pick up free rapid antigen tests at the centre every week. The study shows that the approach is effective so long as more than half the families go along with it. Most of the families accept it and arrange amongst themselves who gets tested when. The daycare centre has also switched to smaller groups. Each group has its own room. If one child tests positive, the whole group has to quarantine. The staff also make sure they abide by social distancing and hygiene rules. Parents have to say goodbye to their kids at the door. We have bells now to make things as cheerful as possible for the children, and they've responded well. We've introduced hand-washing rituals, and the children sing songs while they do it. They enjoy playing with the water. There are 170 children in Nisa and Taha's daycare centre. In the past year, only one child has tested positive. But with the current rise in Omicron cases, that may now change.
The new virus variant will establish more efficiently in the kindergarten age, in the toddler age, and it will spread out there more efficiently.
So Nisa, Taha, their parents and all the other families will have to keep testing for a while to come.
Closing daycare centres and schools and restricting social interaction can have a negative effect on children's emotional well-being and behaviour. Our reporter Hang Xuan Li spoke to the director of Child and Adolescent Psychiatry at Innsbruck University's Medical Centre in Austria. She's been studying the psychological impact of the pandemic on children.
Many thanks for joining us.
My pleasure.
You lead a research project about the effects of the pandemic on children and adolescents in Austria. What are your most important findings so far?
We're looking at kindergarten children and school children up to the age of 13. So the focus is on younger children and young adolescents. And to sum it up in a sentence, the emotional impact, the sense of insecurity they feel, has clearly increased as a result of all the changes that have been happening. The main symptoms that we are seeing are emotional changes, more depressive moods and anxiety issues, more emotional neediness. The children's quality of life is also suffering.
What did you find out that really sticks in your mind?
I was upset by the fact that so many of them spoke about their loneliness during lockdown. It was really a tragedy for the children and difficult for them to bear emotionally that they were no longer able to properly celebrate Christmas, birthdays, confirmation, all of these key family celebrations. And I was concerned about how much the children were affected by the worries of the adults. How will this impact jobs, financial payments, and so forth? I found it upsetting how much they were aware of these troubles.
According to your study, boys and girls had very different symptoms. Why is that?
At the start, the boys were quicker to manifest or externalize their symptoms. You notice it much more quickly when a child is aggressive and doesn't stick to the rules when they kick up a fuss than when a child is withdrawn and quiet and therefore less conspicuous. At the start, it was the case that the boys externalized their behavior much more clearly than the girls. In the meantime, there isn't any perceptible gender difference. Both are equally impacted.
How much will children and adolescents be affected by having to wear masks for so long?
I'm a child psychiatrist, so I wouldn't like to comment on the physical effects of mask wearing, but I can say something about it in relation to my field. Do children find it difficult to interpret the emotions of their parents or teachers? And luckily, it's been confirmed in scientific studies that children don't have any significant difficulties recognizing emotions. Even if this part of your face is covered, you can still see the eyes and hear the voice. So the children don't have any difficulty interpreting the emotions of their teachers or other adults who are wearing masks. They know when they're furious or annoyed, even if they're wearing masks.
To what extent are these findings also valid for children worldwide?
I think that they are quite applicable because there were restrictions, hygiene measures, lockdowns, school restrictions, social restrictions in other countries too. And I think that how a child reacts to these kinds of things is quite transferable to other countries. It's understandable that children react emotionally to it. It doesn't just pass them by, it has an emotional impact on them.
What can parents and policymakers do to counterbalance the psychological impact on children?
I think parents should take a very calm and measured approach to the pandemic, explain lots. Of course, they should monitor how children and adolescents are faring emotionally. We know, for example, in another respect, that eating disorders have soared during the pandemic. It's important that parents of adolescent children watch for weight loss. In my opinion, schools could exercise less pressure, less stress about schooling, and could introduce subjects like psychological health. Children and adolescents could learn something about stress and relaxation. I don't believe this is a lost or psychologically disturbed generation, but I do think it's unstable at the moment. Children and adolescents have been a bit battered by what's happened, so it's vital to see what we can do to counterbalance this.
Thank you.
Countries around the world closed their schools for many months because of the pandemic. Worldwide, nearly 170 million children were unable to attend school for practically a whole year. But here in Uganda, schools were closed for nearly 2 years. In March 2020, rising cases of COVID-19 prompted the government to impose some of Africa's toughest restrictions. Schools only finally reopened this month. After such a long time, many students' lives have changed, and returning to the classroom is no longer on the agenda.
Actually, we thought that the epidemic was going to take us a month or a week, or 2 months. But, of course, we saw what happened. This lockdown kept on, moving, expanding, up to now, after almost 2 years. By the time we closed down, we had about 300 children. Right now, when we open the school, not even 20 have turned up.
You can't come and say, hi, friend, hug yourself that, hey, you are back to school. It feels bad, but you're protecting yourself.
The pandemic has radically changed students' lives. The number of child pregnancies has risen, and many children have had to work to help feed their families. Local authorities estimate 1/3 of students will never return to school. In Germany, many schools have long since reopened. But is that a good thing, given the number of infections right now? Schools have been shown to be COVID hotspots, which is why they were closed part of the time last year. But that meant many students fell behind in their studies. So this year, things are to be handled differently. But what's at stake?
Media and the news. That's the topic in today's English class at the Fritz Karsen School in Berlin. Contrary to last year, lessons are currently given in person in most parts of Germany and not online. Politicians have agreed that for now things will stay that way, but the danger of getting infected is high. I'm a little scared of being in school because of the coronavirus. There are a lot of people here and we change rooms all the time. Every day I'm together with at least 100 people. That's no good, especially when you get home and think, I could have easily learned this at home and be much safer. The Philipp family is relieved that the schools are remaining open, despite the Omicron variant. The parents are only in charge of helping with homework. The weeks of learning from home last year were frustrating. I don't want to watch my own children all day, help them, feed them, and also do the laundry and shopping. I don't want to go back to that. It's not the right thing for our family. Learning from home was not a good option. I didn't learn very much, and I don't want to do it again because it just wasn't any fun. Many children feel that way. They have gotten behind and now have the chance to catch up and see friends every day, deciding factors in keeping schools open despite rising case numbers. Local teacher Ryan Plocher would prefer a compromise from last year. He liked flipping back and forth between live and online lessons.
Working in half groups and alternating between learning from home and learning from school can be a compromise between epidemiological needs and the needs of the students to learn. So between the safety of the pedagogues and the safety of the children, but also their need to learn in school.
Whether schools will remain open despite rising case numbers is up to Germany's states to decide. As far as education goes, they have the final say.
COVID infections often seem to be mild in children. But do children also get long COVID, with symptoms continuing for many months? Our science reporter Derek Williams is here to answer your questions. This week's question comes from Monica Aiken. Can you tell us more about the effects of long COVID in kids?
Upsides in the pandemic have been few and far between, but one of the few is that at least children are less likely to experience severe outcomes from an infection. So they don't often end up in hospitals or worse. But that doesn't mean that some kids won't eventually pay a price for contracting COVID-19. Earlier in the pandemic, expert estimates differed pretty widely on what percentage of children develop long COVID. But researchers in the field now think that the numbers, while significant, are lower than some early guesses. A larger study from last fall discussed in the British Medical Association journal, the BMJ, for instance, found that roughly 1 in 7 kids are still reporting symptoms over 3 months after a COVID infection. Like in adults, the spectrum of long COVID symptoms in kids is also pretty wide. One very serious possible long-term effect is called multisystem inflammatory syndrome in children, or MISC, which can lead to organ failure. Fortunately, it's rare. For example, there have only been around 6,500 cases of it reported by the Centers for Disease Control in the US so far. Recently, the CDC also published the disquieting news that rates of newly diagnosed diabetes were higher in children who had COVID than in those who hadn't, which was an effect already observed in adults. More common effects are often, but not always, similar to those reported by adults with long COVID symptoms. They can include fatigue or breathing difficulties or headaches, and of course, changes to the sense of smell or the sense of taste, neurological symptoms like brain fog or difficulties concentrating are also widely reported in kids, just as they are in adults. It's important to say, however, that pretty much all of what we know about long COVID in children is based on research that was carried out during the Delta stage of the pandemic, or even earlier. We still know little about the potential long-term effects of an Omicron infection. It just hasn't been around long enough yet to determine them.
Infections are soaring again in India, driven by Omicron. But officials are optimistic this wave won't be as devastating as the last. Half of India's 1.3 billion are now fully vaccinated. And the vaccine drive is being expanded to include a booster shot for healthcare workers and high-risk adults, and a first-time shot for teenagers over the age of 15. We visited a vaccination centre in New Delhi.
Finally, it's their turn. India is now vaccinating children older than 15 years as well. Even though schools are closed once again as a third wave surges through the country, these 10th graders hope this will make the difference.
Teachers are unable to mentor students well in online classes, and the students can't concentrate either. Once we are all vaccinated, we can return to the classroom and do better in our studies.
I'm happy to get the vaccine. Now schools will reopen and I'll be able to see my friends. Learning in the classroom is much better than it is online.
It's a good thing that schools are closed right now to prevent the spread of the coronavirus, but they need to reopen now that we are vaccinated. We have examinations coming up.
And it isn't just teenagers who are excited. Healthcare and frontline workers are eligible for a third dose as well. India is calling these precaution doses. The vaccine has been crucial for Aarti, and not just because she's giving shots herself. When the pandemic first struck, Aarti sent her toddler 1,000 kilometers away to live with his grandparents in the state of Bihar, to keep him safe while she continued to work in the hospital.
It's only after I got both shots that I called my son back. For a whole year, I lived away from him. I only saw him on video calls. It was a huge challenge for me. Now, with this third dose, I feel safer against Omicron as well.
There are questions around the efficacy of India's booster program. Most adults in India have received the AstraZeneca vaccine, and the government requires them to get the same kind for their third dose. But studies have found that mixing and matching works better for boosters, and that AstraZeneca is amongst the least effective as a third shot. And importing other vaccines is not the only way out. Experts say India is failing to utilize these, and to explain why.
I really don't think we should chase the Pfizer and Moderna vaccines. They're very expensive compared to the vaccines that are available to us. But India is not using this vaccine, which is locally produced, in its boosting program. So it does not make any sense to me.
For now, however, some protection is better than none. This 60-plus couple is happy they are eligible for boosters and hopes to soon get the whole family jabbed.
I've got 2 grandkids and I'm worried for them, and I would like them to, also be able to be vaccinated. Yeah.
It is, they say, what kept them out of the hospital last year, and is most likely their best shot to keep it that way.
Next, we're off to Indonesia, which has been hit hard by COVID-19. The country has registered more than 4 million cases since the start of the pandemic. Indonesia has also started administering booster shots, some of which were produced in Indonesia itself. But the country is working on its own vaccine too. We met up with one of the scientists involved.
Indonesia's vaccine production in full swing. What you see in these bottles is the Chinese Sinovac vaccine, the #1 immunization available here. Nani Nuraini is in charge of the process. In a factory in Bandung, her team assembles components imported from China.
In the pandemic, access to COVID-19 vaccines has been limited. Of course, when buying, we have to rely on external funds. If we had our own jab to supply our people, then it would be affordable. That way, there's more accessibility and a more even distribution of the vaccines in Indonesia.
Since the pandemic broke out, Nuraini has been working around the clock. The state-owned pharmaceutical company is also hoping to develop its very own vaccine. An exciting process for a scientist. But Nuraini says it's also challenging for her as a mother of 2, especially if things don't go according to plan.
We have this term called the Valley of Death in the manufacturing process. Some products here end up just as a prototype and never make it. You have to bear in mind, vaccines will be given to millions, billions of people, so they need to be affordable too. In the end, a key objective is to be cost-effective and efficient.
Female scientists like Nani Nuraini are still a minority in Indonesia, despite the fact that at university, women in this field are the majority. 8 out of 10 undergraduates are women among the students at the medical faculty next door. Analyzing COVID-19 swab tests is a much-needed skill these days. But only 1 out of 3 of these female students will move on to a doctorate degree.
There are still a lot of stereotypes when it comes to professional science. Many feel a professional teacher or a government employee will just make more money. So many women are discouraged from continuing their studies as a scientist.
We need to work on ourselves if we really love science, but the government should also facilitate and support us in this endeavour. There could be more funding, more laboratories and learning opportunities overseas.
Indonesia has so far fully vaccinated more than 40% of its 270 million people. But with the arrival of Omicron, even more vaccines are needed. The country now launched a booster program early in an effort to prevent the next wave.
So vaccines are still the key to success in fighting the pandemic. And science has once again confirmed that young children are naturally better protected against infection than adults. That's it for today. Don't forget to tune in for next week's COVID-19 special. Until then, stay healthy.